Welcome back, learners. So today in this video I will be introducing a rare genetic disorder which is called as your Tay Sachs disease. Tay Sachs is a genetic disorder that results in the destruction of nerve cells in the brain and spinal cord. The most common form is infantile Tay Sachs disease, which becomes apparent around 3 to 6 months of age, with the baby losing the ability to turn over, sit or crawl. This is then followed by seizures, hearing loss and inability to move, with death usually occurring at the age of 4. Less commonly, the disease may occur in later childhood, which is also called as juvenile or late onset Tay Sachs. So this form tends to be less severe, but the juvenile form typically results in the death by the age of 15. So, in a nutshell, Tay Sachs disease causes a progressive deterioration of nerve cell and of mental and physical abilities or disabilities, that begins around 6 months of age. The disease occurs when harmful quantities of cell membrane component, which is called as gangliosides, accumulates in the brain's nerve cells. It's a fatal disease, most commonly occurring in the children. Results usually in progressive destruction of the nervous system caused by the absence of a vital enzyme, and the name of the enzyme is your hexosaminidase or HEX-A. So it is encoded by the gene HEX-A. So Tay Sachs disease is caused by a genetic mutation in HEX-A gene on chromosome 15, which codes for a subunit of hexosaminidase enzyme, which is your hexosaminidase A. So it's a subunit of your hexosaminidase enzyme, and which is called as HEX-A. Okay. So it is inherited from parents in an autosomal recessive pattern. So the pattern of inheritance is usually autosomal recessive pattern, which results in a build-up of a molecule, which is your GM2 ganglioside, within cells, leading to toxicity. So if you understand that what is GM2 ganglioside? GM2 ganglioside is a type of ganglioside. G refers to ganglioside, and the M is for monocyalic, as in it has a sialic acid, and the 2 refers to the fact that it was the second monocyalic ganglioside discovered. So it is associated with GM2 gangliosides such as Tay Sachs disease. So this is your GM2 gangliosides which I am talking about. Next we will move on to the history. So if you move on to the history, Warren Tay and Bernard Sachs, 2 physicians, described the disease progression and provided differential diagnostic criteria to distinguish it from the other neurological disorder with a similar symptom. Both Tay and Sachs report their first case among Jewish family, and Tay reported his observation in 1881. So he reported his observation in 1881 in the first volume of the Proceedings of the British Ophthalmological Society, of which he was the founding member. By 1884, he had seen the 3 cases in a single family. So by 1884, 3 cases came. 3 cases in a single family came. Years later, Bernard Sachs, an American neurologist, reported similar kind of findings, where he reported a case of arrested cerebral development to other New York Neurological Society members. So Sachs, who recognized that the disease had a familial basis, proposed that the disease should be called amaurotic familial idiocy. However, its genetic basis was still poorly understood. Although Gregor Mendel had published his article on the genetics of P in 1865, Mendel's paper was largely forgotten for more than a generation, not discovered by other scientists until in 1899. Thus, the Mendelian model for explaining Tay Sachs was unavailable to scientists and doctors for that time. And the first edition of the Jewish Encyclopedia, published a 12-volume between 1901 and 1906, described what was then known about the disease. Okay? So this was a brief history of your Tay Sachs disease. Moving on to the pathophysiology, or the pathophysiology and the genetics of the disease. Okay? Now you know that this is a nerve cell which I am talking about, and you get to see this GM2 gangliocyte, and you have the lysosome. So this lysosome, you know that a particular enzyme is associated, that is your hexa enzyme, hexosaminidase A. Okay, so hexa A enzyme is present in the lysosome, right? So what is happening in a normal individual and what is happening in a Tay Sachs individual, a Tay Sachs containing disease. So cells in healthy children. In a healthy children, a lipid or fat called GM2 gangliocyte enter the nerve cell as a source of food. So they enter as a source of food. Among the components of the cells are the lysosome, which I am talking about, which might be thought as stomach of the cell, and contain enzyme called hexa. This hexa basically digests your GM2. So in a normal cell, what you get to see is that GM2 is entering the lysosome. So this is your lysosome, and GM2 is entering the lysosome. And what is being done? GM2 is engulfed by the lysosome. And once it is being engulfed, it is being digested. So the concentration of the GM2 is being reduced in the nervous tissue, nervous cell, by engulfment by the lysosome. That is occurring in a normal child. But a children with Tay Sachs, which is lacking hexa, so that the GM2 proliferation to such a degree that it eventually kills the cell, gradually shuttering down the central nervous system. So slowly GM2 accumulates it to a certain extent that it will shutter down the nervous system. So you know, if hexa enzyme is not present, so what is happening? GM2 accumulates. You get to see these brown colored dots. These are all GM2 which accumulates in the nerve. And slowly when they accumulate to that extent, they will start destroying the nervous tissue or nerve cells. And then comes the various symptoms, or then comes the various important aspects, right, of associated with your Tay Sachs disease. Now moving on to the genetics. So in this flow chart you get to see that without hexa, a fatty acid substance GM2 gangliocyte accumulate abnormally in the cell. Then especially in the nerve cell of the brain, because it could not be disposed of by the lysosome, ultimately bring about the cell damage and death. Right? Next we will move on to the inheritance pattern, the genetics of the disease. So, you know that autosomal recessive lipid storage disorder, it is called, lack enzyme hexa, leads to accumulation of GM2 gangliocyte in the neuron. So this is the gist. Now you know that this condition is inherited in an autosomal recessive pattern, meaning that when both parents are carrier, there is a 25% risk of giving birth to an affected children. I will show you how. So which means both copies of the gene in each cell have a mutation, incomplete dominance. The parent of an individual with an autosomal recessive condition each carry one copy of the inherited gene, but they typically do not show signs and symptoms of the condition. They are the carriers. So here there are two datas. One in every 50 Irish American is a carrier. One in every 250 people is a carrier. Now the genetics. Now the pattern of inheritance. So first is, you understand, a carrier is crossed with a normal individual. A small a is the carrier and another is the normal individual. So you get to see that A normal, capital A small a carrier, capital A small a carrier. So you get to see 50% of the individuals are normal and 50% of the individuals are carrier. On the other hand, if you have two carriers in the family, that is both mother and father, both are carrier, then what you get to see? You get to see that you have 25% normal, 50% carrier and 25% affected. So this is the overall scenario. That is why it is saying that since it is recessive, so autosomal recessive, 25% chance is there that the offspring will be having or will be affected if the mothers are carrier. Okay. Next comes the signs and the symptoms. So when we move on to the signs and the symptoms, you know that general signs and symptoms, first I say, infants initially appear healthy. Symptoms appears not before 6 months of the age. Development begins to slow down. Loss of motor skills and mental function occurs. Unfortunately, the child becomes blind, deaf, paralyzed, mentally retarded and non-responsive, and it becomes fatal at the age of 4. So these are the basic symptoms. Then I will move on to the classification. First is your infantile, juvenile and late onset. Infantile. Infants with Tay Sachs disease appear to develop normally from the 6th month of the birth. Then as neurons become distended with GM2 ganglioside, a relentless deterioration of mental and physical disability begins, which I am talking about in the point. And the child may become blind, deaf, unable to swallow, atrophied, paralytic. Death usually occurs before the age of 4. So all the symptoms which I have talked about comes over here. If I talk of juvenile Tay Sachs disease is rare than other form of Tay Sachs and usually is initially seen in children between 2 and 10 years old. People with Tay Sachs disease develop cognitive and motor skill deterioration, dysphagia, ataxia, spasticity. Death usually occurs between the age of 5 to 15 years. So in juvenile, it may be 15 years when the individual dies, but the individual will die. Late onset, a rare form of this disease known as adult onset, late onset Tay Sachs disease, usually has its symptoms during 30s and 40s. In contrast to the other form, late onset Tay Sachs disease is usually not fatal as the effect can stop progressing. It is frequently misdiagnosed. Okay. So this is here also you have gait, spasticity, cognitive decline, psychiatric illness, particularly like schizophrenia, psychosis, etc. People with late onset Tay Sachs may become full-time wheelchair users in adulthood. So these are the 3 different classifications according to the symptoms. Then comes the classical diagnosis. So diagnosis of Tay Sachs basically occurs cherry red colored spot on eye caused by lipid-laden ganglion cell. So you may have a cherry red colored eye spot on the eye caused by the lipid, right? Then larger startle reflex to noise, that is another symptom. Before 1970, Tay Sachs could not be diagnosed at the birth, but now we have various systems by which we can diagnose even at the birth. Clinical testing is a must. In 1969, researchers discovered the biochemical basis of the disease. Michael Kabak of JHU created an enzyme assay to test for heterozygotes, detect individuals with lower level of hexane. Okay, so hexane is lower level that can be detected. Can detect all mutation but with same inconclusive results. So mutation are now could be detected. Okay. So if we move on to the genetic testing, it is caused by the mutation of hexane at chromosome 15. Exact location is 15q23q24 arm determined in 1990. PCR test for actual mutation give definite results, but only for known mutation. If there is any polymorphism or unknown mutation, then a different line of their diagnosis has to be taken into account. Okay, so that is important. Then comes, the classical treatment. There is no current treatment. Supportive treatments are there. Anti-seizure medicine can be given to prevent the seizure. You can use feeding tube if there is a feeding problem. Proper nutrition and hydration should be given. And if you think about the treatment, there are new strategies. One is your replacement of hexa gene by gene therapy. But the problem is that the genes are difficult to be transported to the neuron, targeted to the neuron, right? Then is your enzyme replacement therapy by replacing hexa enzyme. So the problem is too big to pass through the blood-brain barrier. That is a very important problem. Neurons are unable to take the hexa because it is too big. So even if you give this particular therapy, then also it may not rectify the disease. Then I will move on to the prevention. So for all this disease, one slogan is a must. This slogan is a must, that prevention is better than cure. Prevention is always better than cure. So we will better focus on the prevention if I have the strategies to prevent. First is your prenatal diagnosis. If both parents are identified as carrier, parental genetic testing can determine whether the fetus has inherited the defective copy of gene or not. And that can be done by chorionic villus sampling, CVS. Okay? The most common form of parent prenatal diagnosis can be done in 10 to 14 weeks of gestation. Amniosynthesis is usually performed at 15 to 18 weeks, and this procedure have risks of miscarriage of 1% or less. So you can go with amniosynthesis if you have results, you have some positive results on chorionic villus sampling. Then is your pre-implantation genetic diagnosis. This is most important when we go for in vitro fertilization. It is possible to test the embryo for the disorder prior to implantation. You know that we are doing it artificially. So there may be some defects and this type of disease may arise. So healthy embryo must be implanted into the uterus. So that is why pre-implanted genetic diagnosis should be done, and that can prevent even cystic fibrosis and sickle cell anemia among other genetic disorders. And last but not the least, this is very customized form of prevention, that is your mate selection. In Orthodox Jewish circle, the organization Dor Yeshorim carries out an anonymous screening program so that carriers for Tay Sachs and other genetic disorders can avoid marrying each other. So they basically screen for the carriers, and those are the carriers, they are prevented from being married. And then of course there will be no development, even 25% chance of developing a Tay Sachs offspring. So this is all about your Tay Sachs disease. So I have focused every point of your Tay Sachs disease, whether it is symptoms, whether it is your treatment, whether it is your prevention. Management is the important aspect of Tay Sachs. So where we have discussed about the feeding tubes for swallowing, if there is a swallowing problem, medication like lithium for depression, even seizures can have many medication like tricyclic antidepressants, phenothiazine, haloperidol and risperidone can be given to reduce the adverse effects. So these are some of the management strategy which can manage the symptoms of the Tay Sachs. So with this I complete my class. Stay safe, stay healthy, and if you have any questions, any queries, please drop your comments in the Google Classroom as well as in the YouTube comment box. Thank you.